What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome to my anatomy playlist, which has more than 150 videos of pure, joyful education. Today we'll talk about the most important anatomical terms. We will talk about bones, we'll talk about muscles and their tendons. We'll talk about cartilage, we'll talk about joints and the types of joints. We will talk about your largest organ, which is the skin. And we'll talk about the underlying fascia. Click the like button, click the subscribe button, and let's get started. Let me tell you how the anatomy playlist is structured. In the beginning of this anatomy playlist, you'll find the review videos, which are very condensed. For example, the subject of the anatomy of the head is covered on 3 videos. Part 1 is called Quick Review, Part 2 is called Ultimate Review, Part 3 is called Clinically Oriented Anatomy. The thorax is the same. There is Part 1, Quick Review, Part 2, Ultimate Review of the Thorax, and Part 3, Clinically Oriented Anatomy of the Thorax. Same for the abdomen, same for the pelvis and perineum, same for the upper extremities and the lower extremities. I even have embryology review videos and neuroanatomy review videos, my favorite ever. So here we have 8 times 3 is 24 videos. Just by watching them, you will know more anatomy than most doctors. So make sure to click the save button on this anatomy playlist so that you find it in your YouTube profile or account without hesitation. What does the word anatomy mean? Ana means up, tomy means to cut. So anatomy literally means to cut you up. For the histology and pathology geeks, what is a microtome? Micro means tiny, tomo means to cut. Oh, so microtome is a device that cuts into micro or small slices. This is the same thing. Of course, I will never cut you up because I love you. So what are we going to talk about today? We'll talk about anatomical planes, anatomical lines, anatomical positions, and the terms of movement. We'll talk about the skin and the underlying fascia, including superficial fascia and deep fascia. We'll talk about muscles and the different types of muscles, such as skeletal muscles, smooth muscles, and cardiac muscles. We'll talk about the tendons of those muscles. We'll talk about the cartilage and the types of cartilage. We have 3 types of cartilage. There is hyaline cartilage, there is fibrocartilage, and there is yellow or elastic cartilage. Then we'll talk about the bones, the number of the bones, and the types of the bones. And we'll talk about the joints and the types of the joints. And just like the cartilage has 3 types and the muscles are 3 types, the joints also are divided into 3 types of joints: fibrous joints, cartilaginous joints, and synovial joints. So let's start with the first topic: anatomical positions. This is you standing in the anatomical position. The palms of your hands are facing forwards, not backwards. You are facing forwards towards me, not away from me. Your arms are by your side, and you are in the standing position. For the pros, what is the anatomical position of the male copulatory organ, the penis? The penis in an anatomical position is the erect penis, with the dorsal surface facing up and the ventral surface facing down. And this is the urethra. Honestly, the urethra should be a little lower like this because the urethra occupies the corpus spongiosum and not the corpora cavernosa. To learn more about the reproductive system, please refer to my review videos on the pelvis, and you can find them in this anatomy playlist. This is another position. It's not the anatomical position. This is the supine position. When you are lying like this, facing up, your belly is facing up, your back is lying flat on the bed. There are some medical conditions that are related to body position, such as these. What is the prone position? The opposite. You're lying down, but your belly is facing down, your back is facing up, so you are lying on your belly. If you have difficulty breathing, your pulmonologist or internist or your doctor might put you in the prone position because it's easier to breathe that way. Next, we have the decubitus position on your side. If you're lying on your left side, it's called the left lateral decubitus position. If you are lying on your right side, it is the right lateral decubitus position. We also have the fetal position or the knee to chest position. There is the Trendelenburg position with your feet up and your face down. This might be beneficial to patients who have venous stasis in the legs or patients who have hypotension. We put them in this position to allow more blood to go back to the heart. And there is also the opposite of that, the reverse Trendelenburg position, like this. where your feet are in a lower position than your head. More body positions include the dorsal recumbent position, the standing position, lithotomy position during labor and childbirth, sitting position, Sims position, and squatting position. Next topic, anatomical planes and lines and terms of position. There are many planes in anatomy. There is the coronal plane, also known as the frontal plane. There is the horizontal plane, and there is the median with an N, not with an L, plane, otherwise known as the sagittal plane. Frontal plane is like this. This is the frontal plane. This will divide you into an anterior half in front and a posterior half behind. There is a horizontal plane which will divide you into an upper half and a lower half. And there is a median plane which will divide you right smack in the midline into a right half and a left half. So this is anterior and posterior, upper versus lower, right versus left. Here's an important point. You see this anterior most part of the head, we call it anterior median line. And behind your head is the posterior median line. Do not confuse the word line with the word plane. Now, when you later study neuroanatomy, there are famous slices in the brain. When you slice the brain in the coronal plane, you are slicing like this. You can also slice the brain in a horizontal fashion, like that. Or you can slice the brain in a sagittal manner, like this. And that's why the sutures of the skull are named after these. For example, there is a coronal suture in your skull. There is also a sagittal suture. The midline is the median, just like this, with the N. However, right and left, near it, we have the medial. Medial with an L is close to the median, but medial is not in the midline. So this is the right medial, this is median, this is left medial. If you wish to see more anatomy videos like this in the future, please drop a bone emoji in the comments. The median is known as the sagittal suture or the sagittal plane. The medial is parallel to the median, so we call it parasagittal. So if something is close to the midline, we call it medial. But what if something is far away from the midline? What do you call that? You call it lateral. So this hand is lateral to this shoulder, and this shoulder is lateral to the vertebral column. The anatomy lingo. Front means anterior, back means posterior. So this is anterior, this is posterior. Upper has many names. You can say upper, you can say superior, you can say rostral, or you can say cranial, towards your skull, up here, not down here. Lower is also known as inferior or caudal, closer to your tail end. If something is related to your belly, it's ventral. If something is related to your back, it's dorsal. Ventral, dorsal. The opposite of medial is lateral. The opposite of proximal, which is right here, is distal, this way. The opposite of superficial is deep. Think like a surgeon. Let's say that you are operating on the patient's chest, for example. What's the first layer that you will cut with your scalpel? The answer is skin, followed by superficial fascia, followed by deep fascia, etc. So you're going from the superficial to the deep. Then if we have cavities, for example, the stomach, inside the stomach is called internal, outside the stomach is external. Whenever you see a CT scan of a patient like this, anterior, which is towards the patient's chest or belly, is here, but posterior, which is towards the patient's back, is down here. This side is the patient's right, so this is the right lung, and this is the left lung. To make sense of this, imagine that the patient is lying on his back with his feet pointing towards your face, and you are looking up towards the patient's belly. Next, terms of movement. Flexion versus extension, abduction versus adduction, so abduction versus adduction, supination versus pronation. Flexion, get this side closer to that side by making the angle narrower. The opposite of that is extension. Extend your forearm, make the angle wider. The thumb is a special situation whose flexion is like this, extension is the opposite. Next, adduction versus abduction. Adduction means close to. So when you're getting your arm closer to your trunk, this is adduction. But abduction is going away from. For the pros, have you ever heard of the adrenal gland? Yeah. Why do you call it adrenal? Because it's next to the kidney. Oh, it's just above the kidney. So it's near the kidney. It's adrenal. How about the word abnormal? What does that mean? Ab means far away from normal, far away. Rotation. There is internal rotation, as in this arm, it's internally rotated or medially rotated to the inside. The opposite of that is external rotation, like this, to the outside, as in this arm. When your palm is facing forwards, it's called supination. When you do the opposite, and now your knuckles are facing forwards, it's called pronation. The palm of your hand versus the dorsum of your hand. Supination versus pronation. When you actually do this, when you are supinating, the radius is straight and the ulna is straight. These bones are parallel to one another. But when you pronate, the radius will actually jump over the ulna like this, which is very disrespectful if you ask me. In life, you gotta stand up for yourself. Otherwise, people will walk all over you. Here is a little pearl for you. During embryological development, your upper extremities rotated in an opposite fashion when compared to your lower extremities. And that's why when you flex your elbow, your forearm is in front of you. But when you flex your knee, your leg is behind you. And this is because of the opposite rotation of the upper extremity and the lower extremity during embryological development. One of them rotated clockwise, the other is counterclockwise. You want to take it to the clinic? In front of your elbow, called the cubital fossa, and behind your knee, called the popliteal fossa, can have a rash in a disease known as eczema or atopic dermatitis. What type of hypersensitivity is atopy? Do you consider atopy to be type 1, type 2, type 3, or type 4 hypersensitivity? If you know the answer to that question, please comment below. If you want to feel your patient's pulse, one of the easiest arteries to feel is the radial artery. You are supposed to palpate it using 3 fingers, the index finger, the middle finger, and the ring finger. And you palpate it by pressing the artery against the bone underneath it. What's the name of the bone under this radial artery? It's called the radius. Oh, that's why we say radial artery, because it's related to the radius. There is an opposite artery on that side. It's called the ulnar artery, because it's related to the ulna. We are done with the first topic. Now let's talk about the biggest organ of your body, the skin. The word cutis means skin, and therefore cutaneous is related to the skin. Your skin is made of epidermis, followed by dermis. Go even deeper is hypodermis. Epidermis is an epithelial tissue. Dermis is a connective tissue. Hypodermis, also connective tissue. Tissue, what is a tissue? A tissue is a collection of cells. A group of cells is called a tissue. How many types of tissues do we have in the body? Only 4 types of tissue. Number 1, epithelium. Okay, epithelial tissue, that's number 1. Number 2, connective tissue. Number 3, muscle tissue. Number 4, nerve tissue. Epithelium, connective, nerve, and muscle. Epithelium, connective, nerve, and muscle. How about the bone? Mostly connective tissue. How about the blood vessel? Connective tissue, lined by epithelium. How about lymphatic vessels? Connective tissue. How about fat cells or adipose tissue? Connective tissue. Tendons, ligaments, connective tissue. But back to the skin. Your epidermis has thick keratin for protection. Under the epidermis, there is a basement membrane. Then we have the dermis. The dermis contains sweat glands, hair follicles, blood vessels, and sensory nerve endings. So we find the sensory nerve endings in the dermis and not the epidermis. The sensory nerve endings are many, including Merkel's corpuscle, Meissner corpuscle, Pacinian corpuscle, Raffini corpuscle, or body. What is a corpuscle? Well, back in the good old days, which were not so good, when Isaac Newton was talking about the atoms or the photons of light, he described them as a corpuscle. A corpuscle is a sphere, or something that it looks like a sphere. Your red blood cell could also be described as a corpuscle. And that's my favorite type of corpuscle. Epidermis, dermis, hypodermis. The epidermis has many sublayers, including stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, stratum basale, which sits on top of the basement membrane. Basale basement. As for the dermis, it has a papillary layer and a reticular layer. Each one of these layers has a meaning, and you can learn about this topic by watching my video titled The Skin. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. Remember that the dermis of the skin has blood supply and nerve supply. Blood supply has a deep plexus and a superficial plexus and arteriovenous anastomosis in between. As for the innervation, we have two types of innervation, somatic and autonomic. Somatic means voluntary, autonomic is involuntary. For example, touch sensation is a somatic sensation. But telling your sweat glands to make more sweat or less sweat is an autonomic, which means visceral, which means involuntary function. Your skin has sweat glands, and the sweat glands will help you evaporate water, which will cool the temperature of your body. Evaporating water is an endothermic process, and for the chemistry buffs watching this video, if it's an endothermic process, do you think that delta H for the system will be less than 0, greater than 0, or equal to 0? If you know the answer to this question, please comment below. The sweat glands are the only part of the skin that can let water out of your body. The rest of the skin is not permeable to water, allowing neither gain nor loss, which helps keep the water inside your body to maintain your serum osmolality. To learn more about the serum osmolality, I have a separate video on this topic, which you can find in my physiology playlist. Next, the skin appendages, or the accessories of the skin, so to speak. The appendages of the skin include hair, nails, sweat glands, and sebaceous glands. Hair, of course, you know the hair. It has a long shaft and it has a root. If you cut the shaft, your hair will regrow again. But if you cut the shaft and took the root out, this particular hair particle is not coming back. Next, the nails. Your nail has a root deep inside. It has a body and it has a free border that you can see. Please do not confuse the root of the nail and the bed on which the nail lies down. Sweat glands have a duct, which is just a conduit, and coiled part. The coiled part is what actually makes sweat. Where did you get the sweat from? Well, I borrowed some fluid from your plasma, which means from your capillary blood. Remember that capillary blood is in the dermis, not the epidermis. And the coiled part of the sweat gland is also in the dermis, not the epidermis. So let me borrow some fluid or water from your blood, and then I'm going to modify this water and make it into sweat, and then push that sweat out. It will evaporate and cool your body down. Sebaceous glands make sebum. What is sebum? It's an oily secretion, commonly found in the scalp and other parts of the body. We are done with this. Now let's talk about the fascia under the skin. We have two types of fascia, superficial fascia and deep fascia. Skin is more superficial, fascia is more deep. Remember when we said the skin has epidermis and then dermis, and then we have hypodermis? Believe it or not, the hypodermis is the superficial fascia. Since this layer is under the skin, we call it hypodermis. Since this fascia is more superficial compared to the deeper one, we call this superficial fascia and this one deep fascia. Make no mistake about it. All the fascia is connective tissue. This deep fascia will become investing fascia. What do you mean by investing? Bitcoin and rubbish like this? No, by investing I mean wrapping around. Oh, it's the fascia that will wrap around. This deep fascia will wrap around your viscera. We call it fascia visceralis, sometimes called internal fascia. And the deep fascia will wrap around some muscles called the investing fascia of the muscles. Our next topic is muscles and their tendons. Let's talk about muscles. First, some questions to test your knowledge. How many muscles are there in the human body? What's the strongest skeletal muscle in the human body? What is the longest muscle? How about the biggest muscle or the thickest muscle? Which skeletal muscle is essential for survival? And roughly what percentage of the total body weight is made of muscles? Please pause the video and let me know the answers to all of these questions. Comment below. Here are the answers. How many muscles? Well, it's about 620. Some people have more muscles than others. For example, when you study the upper extremities, you will learn about the palmaris longus muscle. Not every person has it. What's the strongest skeletal muscle? It's the masseter. The strongest smooth muscle, I think it's the uterus. I mean, the uterus can push an entire baby out. What is the longest muscle? Sartorius for sure. The thickest or biggest muscle, the gluteus maximus. And that's why you need to get your head out of your gluteal region. The skeletal muscle that is essential for survival is the diaphragm. Most students unfortunately think of the diaphragm as a smooth muscle. Not true. The diaphragm is a skeletal muscle, somatic muscle, supplied by a somatic nerve known as the phrenic nerve. What is the root value of the phrenic nerve? C345 to keep the diaphragm alive. C345, keep the diaphragm alive. What percentage of total body weight is muscle? It depends on the person. If you are a very muscular dude, maybe 40% of your body is muscles. Types of muscles: striated and non-striated or smooth. Striated means what? It has these transverse striations, these black lines. Striated muscles include skeletal muscles, which are attached to the skeleton. These are voluntary. And cardiac muscles, involuntary. The smooth muscles are non-striated. You do not find any transverse striations here. Smooth muscles are involuntary, including the uterus, including the muscles in the wall of the colon and the rectum, and the muscles in your bronchi, and the muscles in your blood vessel. Skeletal muscles are multinucleated. Each muscle cell has many nuclei. Cardiac muscles only have one nucleus, mononucleated. Smooth muscles, same, one nucleus per cell. The cardiac muscles are branched, but skeletal muscles are not. Each muscle is made of a bunch of muscle fibers, also known as myofibers. The word myo means muscle. Each myofiber is made of myofibrils, and each myofibril is made of myofilaments. The myofilaments could be thin, actin, or thick, myosin. So we have muscle fibers, we have myofibrils and myofilaments. Which one of these is the actual muscle cell? And the answer is, it's the muscle fiber, which means that one muscle fiber equals one muscle cell. The ends of the muscles are tendons. The tendon is going to help the muscle attach to a bone. For example, your biceps muscle is attached to bones on both ends. Triceps muscles attached to bones as well. A tendon is a tough, cord-like structure. Made of what? Made of collagen in bundles. Bundle upon bundle upon bundle upon bundle. The tendon is attached to a skeletal muscle on one end and to bone or fascia or the dermis of the skin on the other end. And just like the bone is surrounded by periosteum, peri means around or outside, osteum means bone. By the same token, the tendon is surrounded by a peritendinium. The peritendinium of the tendon is continuous with the perimesium of the muscle. What is the perimesium of the muscle? The perimesium of the muscle surrounds a bunch of muscle fibers, creating bundles. So this is a bundle, another bundle of muscle fibers. This is one muscle fiber or one muscle cell surrounded by endomysium until you form a bundle of fibers. The entire bundle is surrounded by perimesium. And then you add lots of bundles together and surround all the bundles by an epimesium. The tendon of the muscle could be rounded like a cord, such as this one, or could be flat like a ribbon, sometimes called aponeurosis. Aponeurosis is a flat tendon. Next, let's talk about cartilage and the types of cartilage. There are three types of cartilage: hyaline cartilage, fibrocartilage, and yellow elastic cartilage. You see, this is a bone, this is a bone. This is the articular surface of the bone, and this is the articular surface of the bone. Why do you call it articular surface? Because the surface at which the bone will articulate with another bone. To articulate is to form a joint. These articular surfaces of the bones are covered by cartilage. What type of cartilage? Hyaline cartilage. This is your bone. This is the shaft of the bone, and these are the ends of the bone. The shaft is known as the diaphysis. Dia means true, so it's the true physis. The end is called the epiphysis because on top. Epi means on top. Between the epiphysis and the diaphysis, you have the metaphysis. The metaphysis has a cartilage plate made of hyaline cartilage. And this is how you grow taller, because this cartilage will ossify and become bone this way and this way so that you get taller and taller and taller. And this is known as endochondral ossification. Chondro means cartilage, so the cartilage will die. And on top of that, we will build new bone. Ossification means bone formation. And that's why, let's say as a child, someone traumatized me in my metaphysis, which contains the epiphyseal cartilage plate. Then I'll have deformity. For example, if the trauma was on my right leg but not the left, then the left leg will continue to grow but the right will not. So there will be discrepancy between the height of both legs. Let's compare between bone and cartilage. Bone is hard, but cartilage is firm, which means less hard. Bone is made of type 1 collagen, but cartilage has type 2 collagen. Bone is vascular, but cartilage is avascular or non-vascular. Bones are made of osteocytes, cartilages of chondrocytes. The matrix of the bone is calcified, that's why it's hard, but the cartilage matrix is not calcified, that's why it's not hard. With cartilage, remember the 4 A's. Cartilage is avascular, alymphatic, aneural, and acalcified. Cartilage is without blood vessels, without lymph vessels, without nerves, and without calcification. The cartilage and the bone are made of what? They are made of matrix, cells, and minerals. In the cartilage, the matrix has water, type 2 collagen, not type 1, glycosaminoglycans, or GAGs for short, and proteoglycans. You know what the word proteoglycan means? Prote means protein, glycan means carbohydrates, glyco, sugar. Oh, carbohydrates and proteins. Hey, what's the difference between proteoglycans and glycoproteins? If you know the answer to this question, please comment below. The cells of the cartilage are chondrocytes. Who made them? Chondroblasts. The mineral in the cartilage is not calcified. Here is a cool mnemonic to remember the different types of collagen. Collagen is part of the connective tissue. Type 1 collagen is found in bone. This is the mnemonic. Type 2 is in cartilage. Type 3, look at how flexible this is. Type 3 collagen is in flexible structures such as blood vessels. Type 4 is under the floor. What do you mean by the floor? I mean the basement membrane. Type 5, look at this coily action. You find it in the hair and the placenta. The types of cartilage are 3. Hyaline cartilage, fibrocartilage, and yellow or elastic cartilage. Where can we find hyaline cartilage? Remember the epiphyseal growth plate of the bone? This is hyaline cartilage. Remember the articular surface of the bones? Hyaline cartilage. The cartilages of the larynx are hyaline cartilage. The trachea and the bronchi, hyaline cartilage. The cartilage of the thoracic wall in the costal cartilage. Remember that your ribs are mostly bone, but the last part has cartilage. This is hyaline cartilage. Your nose has hyaline cartilage. The second type of cartilage is fibrocartilage. To make it easy, think of fibrocartilage as in the midline. What do we have in the midline? There is the vertebral column. Oh, so you need intervertebral discs. In the midline, they are made of fibrocartilage. How about the symphysis pubis? The symphysis pubis is in the midline, made of fibrocartilage. The temporomandibular joint is not in the midline, but close enough, also fibrocartilage. And there are other examples discussed in great detail in my video titled Cartilage. Third, we have yellow or elastic cartilage. For flexible support, you find this in the ear pinna or the auricle of your ear. The eustachian tube is also yellow elastic cartilage. The tip of the nose, yellow elastic cartilage. And the epiglottis of the larynx, yellow elastic cartilage. Next, bones. Remember, bones have the word 1 in the name, so they have type 1 collagen. There is a video in my anatomy playlist titled You Have 206 Bones. Speaking of adults, of course, because children have more. In that video, I've told you the name of each one of the 206 bones, and we counted all of them. In biology, there's an exoskeleton. Humans are not like this. And an endoskeleton. Humans are here. What's the difference? Exoskeleton covers the whole organism from the outside, but endo means on the inside. Endo means into, inside. Your endoskeleton is like the chassis of the car. It's the foundation, on top of which you put the rest of the car. Similarly, your endoskeleton is the foundation upon which we're going to put the muscles and the tendons and the ligaments and the fascia and the skin, etc. Your skeleton is made of an axial skeleton in the midline and a appendicular skeleton on the right and on the left. The appendicular skeleton on the both sides has upper extremities and lower extremities. The upper extremities have a shoulder girdle. made of the scapula and the clavicle, whereas the lower extremities have a pelvic girdle, which is made of the hip bone. Remember that the hip bone is made of 3 pieces: the ilium, the ischium, and the pubis. Let's see if you still remember. What type of cartilage is the symphysis pubis? Please let me know in the comments. Here's another question for you. How many bones constitute the skull? Let me know your answer in the comments. What is the building unit of the human body? It's the cell. A bunch of cells gathered together form a tissue. A bunch of tissues combine together to form an organ. A bunch of organs will make a system, and a bunch of systems will make your entire body. Look at the thrill in his face. He's excited to learn anatomy. There are many types of bones and many classifications for bones. Here is one classification: compact bone versus spongy bone. Compact bone is known as cortical bone, very tough. Spongy is less tough. It's called trabecular bone. What is trabecular? Trabecular meshwork is something that looks like a net. Oh, okay. Something squishy or squishier than the compact bone. Make no mistake about it, both of them are hard if you compare them to the cartilage. However, compact bone is more compact, meaning harder, than the spongy bone. Because spongy bone or trabecular bone is made of trabecula, you can see a bunch of cavities in the middle. So yes, this has cavities. But compact bone does not. Compact bone is denser and harder, unlike the spongy or the trabecular bone. Where do I find compact bone? On the outer crust of the bone. Oh, the outer crust has to be compact to make it tough. The outer shell, compact bone. The diaphysis, compact bone. But you find the spongy or trabecular bone in the medulla, which is at the core of the bone. This is where you find the bone marrow. And the bone marrow needs what? Needs cavities. Because within these cavities, we will make your blood cells, including your red blood cells, white blood cells, and platelets. Yes, indeed, your blood cells come from your bone marrow. From the core of the bone, there is blood. The inner shell of the bone has trabecular meshwork. The epiphysis of the bone has lots of trabecular bone. Why do I need compact bone? For structure, for rigidity, for weight bearing. Why do I need trabecular or spongy bone? It has a greater surface area. It allows bone remodeling and reshaping. And of course, you need greater surface area to allow articulation with another bone. And that's why you find it at the ends of the bone. That's the story of trabecular bone. Your bone cells are osteocytes. Who made them? Osteoblasts will build up osteocytes. How about osteoclasts? Nuh-uh, they cut down bone. Remember that bones are hard, they have type 1 collagen, they are vascular, they have osteocytes, and the matrix is calcified. And last, let's talk about joints. The anatomical joints, I mean, not the Joe Rogan type of joints. The study of joints is called arthrology. Ology means the study of. Arthro means joint, because joints articulate. What is arthritis? Inflammation of joints. Arthro, joint. Itis, inflammation. What's the definition of a joint? The meeting or joining of 2 or more bones of the skeleton. What are the types of joints? Remember that cartilages had 3 types. We had hyaline cartilage, we had fibrocartilage, and we had yellow elastic cartilage. Similarly, the types of joints are 3. Fibrous joints, cartilaginous joints, and synovial joints. Fibrous joints allow minimal or almost no movement whatsoever, such as the sutures between your skull bones. I mean, can you move your parietal bone from your temporal bone? Nuh-uh, it's not gonna happen. Fibrocartilaginous joints allow for limited movement, better than fibrous, but not as robust as synovial. We find fibrocartilaginous joints in the pubic symphysis or symphysis pubis, which moves a little during child labor and birth to allow for the baby to come out. The intervertebral discs, limited movement. And the costochondral junction. What is this? Well, this is the sternum or the breastbone, and these are ribs. The first part of the rib is made of cartilage, like this, and then it's bone. So cartilage, then bone. What's the name of this junction? It's going to be called costochondral junction. This costochondral junction has a joint because it's an articulation between 2 bones. Or in this case, it's a bone and a cartilage, but you get the idea. The costochondral junction is fibrocartilaginous joint. Last, we have synovial joints. They give you the widest range of movement possible, such as your shoulder joint, for example. Costovertebral, between the rib and the vertebral column behind. Temporomandibular joint are synovial joints. Sacroiliac joints are synovial joints. This is a synovial joint. What does it have? Well, it has a cavity, all right? What's in the cavity? Fluid. What do you call the fluid inside the synovial joint? Synovial fluid. And then what else we have? We have ligaments, such as the cruciate ligaments. Cruciate means shaped like a cross. One is in front of the other. Then we have a joint capsule, as you see. The joint capsule is lined by a synovial membrane. This is the membrane that creates synovial fluid. So you have a joint capsule lined by synovial membrane, and the synovial membrane will secrete synovial fluid within the cavity of the synovial joint. This is the articular surface of the upper bone, and this is the articular surface of the lower bone, and of course they are covered by cartilage. What is the type of cartilage that you see at the articular surface of the bone? Please comment below. Take it to the next level by watching the next videos in this anatomy playlist, especially my famous review videos. I have review videos for the head and neck, for the thorax, for the abdomen, pelvis and perineum, upper extremities, lower extremities, neuroanatomy, and even embryology. These are some of the best videos that I've ever created, out of 2,400 videos and counting. Once you master anatomy, why not take care of surgery? I have a surgery high yields course on my website, medicosisperfectionalis.com, which comes with videos, notes, and cases. It will teach you about cardiothoracic surgery, neurosurgery, trauma surgery, preoperative care, postoperative care, general surgery, ophthalmological surgery, pediatric surgery, and much more. If you value what I do, help me make more videos by supporting the channel. Go to buymeacoffee.com/medicosis. There are more than 600 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.